This is Dr. Ali, and in this video we will discuss how to clean your teeth and achieve a good oral hygiene. Teeth cleaning is the removal of a dental plaque and tartar from teeth in order to prevent cavities, gingivitis and gum disease. Severe gum disease causes at least 1/3 of adult tooth loss. Cleaning of teeth in a dental office includes teeth scaling, its polishing, and debridement has to be done if too much tartar has built up. This is usually followed by a fluoride treatment for children and adults. Between cleanings by a dentist, a good oral hygiene is essential for preventing tartar buildup, which causes the problems mentioned before. This is done by carefully and frequently brushing with a toothbrush and the use of a dental floss to prevent accumulation of plaque on the teeth. We will now be looking into the methods of preventing teeth problems and to maintain a good oral hygiene. Dentists nowadays prefer the use of interdental brushes to dental floss. Apart from being more gentle to the gums, it also carries less risk for hard dental tissue damage. There are different sizes of brushes that are recommended according to the size of the interdental space. The use of dental floss is an important element of the oral hygiene, since it removes the plaque and the decaying food remains stuck between the teeth. This food decay and plaque cause irritation to the gums, allowing the gum tissue to bleed more easily. Flossing for a proper interdental cleaning is recommended at least once per day, preferably before bedtime, to help prevent receding gums, gum disease, and cavities between the teeth. Dental professionals don't usually recommend oral irrigation as a great way to really clean teeth and gums. Although oral irrigators get what toothbrushes and floss can't reach 3 to 4 mm under the gum line, the jet stream is not strong enough to remove plaque and tartar, so the only result of this procedure is just a feeling of cleanliness and freshness, not disruption of plaque and bacteria. Foods that help muscles and bones also help teeth and gums. Breads and cereals are rich in vitamin B, while fruits and vegetables contain vitamin C, both of which contribute to healthy gum tissue. Lean meat, fish, and poultry provide magnesium and zinc for teeth. Some people recommend that teeth be brushed after every meal and at bedtime, and flossed at least once per day, preferably at night before sleep. For some people, flossing might be recommended after every meal. Some beneficial foods may protect against cavities. Fluoride is a primary protector against dental cavities by making the surface of teeth more resistant to acids during the process of remineralization. Drinking fluoridated water is recommended by some dental professionals, while others say that using toothpaste alone is enough. Milk and cheese are also rich in calcium and phosphate, and may also encourage remineralization. All foods increase saliva production, and since saliva contains buffer chemicals, this helps to stabilize the pH to near 7 in the mouth. Foods high in fiber may also help to increase the flow of saliva. Detrimental foods such as sugars are commonly associated with dental cavities. Other carbohydrates, especially cooked starches, may also damage teeth, although to a lesser degree, since starch has to be converted by enzymes in saliva first. Sucrose, or the table sugar, is most commonly associated with cavities. The amount of sugar consumed at any one time is less important than how often food and drinks that contain sugar are consumed. The more frequently sugars are consumed, the greater the time during which the tooth is exposed to low pH levels, at which point demineralization occurs, below 5.5 for most people. It is important therefore to try to encourage infrequent consumption of food and drinks containing sugar so that teeth have a chance to be repaired by remineralization and fluoride. Limiting sugar-containing foods and drinks to meal times is one way to reduce the incidence of cavities. Sugars from fruit and fruit juice is equally likely to cause cavities. Acids contained in fruit juice, vinegar and soft drinks lower the pH level of the oral cavity, which causes the enamel to demineralize. Drinking drinks such as orange juice or carbonated drinks throughout the day raises the risk of dental cavities tremendously. Another factor which affects the risk of developing cavities is the stickiness of foods. Some foods or sweets may stick to the teeth and so reduce the pH in the mouth for an extended time, particularly if they are sugary. It is important to remove any food sticking to the teeth. Regular brushing and the use of dental floss also removes the dental plaque coating the tooth surface. Sugar-free chewing gum stimulates saliva production and helps to clean the surface of the teeth. It assists oral irrigation between and around the teeth, cleaning and removing particles, but for teeth in poor condition it may damage or remove loose fillings as well. It is important that teeth must be cleaned at least twice a day, preferably with a toothbrush and fluoride toothpaste. Visit your dentist and get your teeth cleaned twice a year, to avoid oral hygiene problems and to keep your gums healthy. The Growing Dentist team helps you to achieve a good dental care by providing you with free online consultation.
Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.